Welcome to Healing with Dr. Kim. Today's segment is going to be focused on pain management with a patient named Sharon. Sharon, thank you for joining us. Dr. Kim, thank you for being here as usual. We're going to talk about pain management. Can you tell us a little bit about what type of pain you experienced?
Well, when I first came to see Dr. Kim, I had chronic all over pain, 24/7, not acute, but very chronic. I had to stop work, and it was very debilitating.
Did you have anything physically causing it that you thought maybe could be the root cause?
No, I had seen a lot of different physicians. I did a lot of testing. By the time I saw Dr. Kim, I was pretty much at my wit's end with that. So
how long had you suffered before you found Dr. Kim?
Probably a year and a half.
I can only imagine what that did to you mentally and emotionally, right?
It was a very difficult time. When I saw Dr. Kim and I came to see him, it was amazing. The first, the words he said to me after I told my story was, that's a lot of suffering. So I knew I was at the right place.
Good. Dr. Kim, what triggered you to know how to treat her? Because you're in great shape now, right? Still a patient, but feeling much, much better.
Yes.
So tell us how you treated her.
You know what? I think that journey actually began with my own journey. I had chronic pain similar to what she had gone through. And in my journey, I've gone through probably 50 different healers. And finally, I found a gentleman who ended up a physician who does acupuncture, who ended up becoming the president's acupuncturist. And that style of acupuncture is very different in that it's very science driven. So the acupuncture, of course, is an ancient Chinese medical procedure for 5,000 years, but the new American acupuncture uses science to help. And when I first talked to Sharon, it really reminded of what I had gone through, because I had chronic pain. It was really killing me, and the doctors would say, we can put you on medication, we can do procedures, we can do surgery. And I did everything they told me to do, because at that time I believed in our system, our way of practicing medicine, and it backfired. It made it worse. And I couldn't do anything. They were saying, we can do another surgery or you can be disabled. And my son was just born, and I didn't look forward to being in disability or having a surgery. And further research said that if you had one surgery and you didn't get the benefit, likelihood of you getting benefit from further surgeries just went down. So what I remember is, number one, you can't just treat pain. If you just treat pain, then you have patient for life. And guess what? In that case, then Ms. Sharon would be still suffering and I would be benefiting. And I don't think that's right. So what I've learned how to do that's very unique is to communicate with pain, understand the pain, communicate with pain. And in this case, this really came from the place of nerve. And the nerve, meaning there's burning pain, there's also punishing pain. It's not just everyday pain, aches and pain you have. And the way we do that is neuroanatomic acupuncture. Neuroanatomic acupuncture is very different because it uses different methods to communicate with the brain and nervous system. So first, I can use the ear, scalp to communicate with the brain and nervous system to begin giving her a break. But more importantly, the bulk of the work is done through electricity. Electricity is how our nervous system communicates. So I have various different tools to facilitate, open a dialogue with her pain, which was nerve pain. And by using different modalities of electricity, for example, I have electric tools that uses 1/1,000,000th of the current that other physicians use, to different configurations of acupuncture that is optimized for using electricity to communicate with the pain. So I think that was a big thing for us. And the other thing was that I think my having suffered the chronic pain, I was able to relate to her suffering instantly, because it's I remember the hopelessness because the pain, like what Sharon had, really robs you of your life and functionality.
Exactly, and I think you feel like you just can't function and do anything because you feel so badly, and then emotionally, psychologically, it really can damage you. How did you know where exactly on the body, where on the ear, where on the scalp? How do you know where to place the acupuncture needles?
So there are two techniques. One technique is by textbook, and that is the teacher who taught me, who went on to become to treat several presidents in Korea, told me that there are light points and there are dead points. The dead points are easy. It's you buy a book and they tell you the dead points. Light points are a little harder, and what you have to do is you talk to the patient, and then you have to probe the different parts of the anatomy, and then it will give you a signal that I need to be needled here. And there are different ways of doing that. For example, German acupuncture that I recently learned, you probe with needles, and then basically the points that need to be needled, almost like the needles disappear into the body. And I think Sharon had that experience also.
Right.
And then other points are exquisitely tender, and I think you've had that as well.
Right.
But the other things are driven by what the scientists have found in neurosciences, and then correlating that through different studies and having an idea, or it can be just observation. Like some, I think that a lot of the ear acupuncture was actually observation made by a French physician, neurologist, on what the Bedouins did in terms of getting rid of pain. They would actually use very hot metal and mark the areas of ear, and the pain would disappear. Of course, as a physician, you can't just do the same thing like that.
Right.
So we use acupuncture needles for that.
How often did you see her when she first became a patient?
Sharon can tell you more about the journey and how often and what is the difference.
How long
now.
have you been a patient of Dr. Kim?
Since October, so probably 9 months, 9 months.
Okay.
And then when I first came here, we do twice a week. I see Dr. Kim, 2 acupuncture sessions twice a week, and then Jeannie for counseling. And I think that the whole concept here with the counseling and the acupuncture and my part in it, and also my husband's part in it.
Oh, absolutely.
It's a huge team effort. And then you, as a patient, I have to listen to Dr. Kim and Jeannie, and then I also feel that I'm listened to too, because I know you said to me one time, you have to be a doctor too. You have to tell me what you need. So I think that communication and that teamwork was essential for me.
I think that's key with your practice here at Georgia Integrative Medicine is that it is a team approach from you and your staff, but also with you and the family, because it affects what you have gone through and what you continue to go through on a much lesser basis, right?
Right.
It affects the family in every way, and you've got to be aware of that. Now, let's talk a little bit about some other methods of pain management. I know some patients use cold laser. Have you used cold laser on Sharon, or is that not applicable to her?
I think the cold lasers are most helpful for wound healing purposes, whereas Sharon's situation was there's a phenomenon known as negative feedback and positive feedback. Negative feedback means if something's not right, so body gets a correction and then makes a correction, and then it stays on course through negative feedback. Positive feedback means that you have pain and it causes more pain, and then it causes more pain, more dysfunction, more pain, more dysfunction, and that cycle had to be broken. And unfortunately, I think you have been to other acupuncture treatments, and the big difference I think is that most of the acupuncture is classically trained, and they operate by more of a poetry, qi, and concepts that are not validated in science. And I really appreciate the ancient approach, but what I found that is my own experience when I had chronic pain, those approach did not help me, and so I had to find another way that made sense, and science actually has a lot of tools. So in this case, it really had to do with first connecting with her pain, and it sounds strange. I have to connect with her, but I also have to connect with her pain and negotiate with the pain,
Exactly.
and ask the pain to like stop torturing my patient at first, and then now that's been done because the nerve pain that people have, and you know it's a nerve pain when you know that it's unrelenting, burning and searing and also compressing kind of pain. Then it's, to me, that's nerve pain until proven
Right.
otherwise. And when you have that, then you have to use neuroanatomic techniques to cut the relationship between the pain and the brain, then reset the brain so the brain can recognize that pain is not normal. So that's the first thing. And the second is go to the areas where the muscles and nerves, tendons, ligaments think that pain is normal. And they have different response. When you touch them, it's different. Either they're really hard like wood, or they just feel, the muscles feel all bunched up, and they just feel angry. When you touch it, you can feel it. And I think most patients, at least I could tell, like and I think Sharon also, it really helped that she is very spiritual, and she is also very, very intuitive. And having that combination, I mean, these days, she drives the care. She'll say, how about we do a deep abdominal treatment? And how about we do a nerve treatment? How about we do a muscle treatment? And because through the communication, I think Sharon knows how to differentiate the different discomforts that you have.
I think that's key. And as we wrap up, I know that you are thankful that you found Dr. Kim
I am.
and
very
Jeannie
thankful.
because you look great, and
you.
your pain is on a scale of 1 to 10 from where it was in October and where it is now. Sharon, as we wrap up, where is it today?
I would say a 3.
That's awesome.
Yeah,
But I also want to ask you, what are you doing now that you weren't able to do before?
Oh, that's a great question, Dr. Kim, and I was going to try to fit that in,
Sure.
but I'll tell Lana. So the great thing, when I first came here, I didn't think I would be able to go back to work or do anything, and I just took a job where I'm going to be a PE teacher.
Oh my goodness.
Which is unheard of for me. It was so
That's really
exciting
great
for
news.
me. Yeah, I just never even thought I would be able to even do that again. So
That speaks volumes
Yep.
to what you've done to help her. But I think you hit a key point, is that we individually also need to take responsibility for our health and our bodies.
Right.
And when we find a practice like Dr. Kim and Jeannie, it just makes it a lot easier to do that, right?
You're right, Lana. Absolutely.
Thank you.
You're welcome.
Stay with us. When we come back, we're going to have more on healing with Dr. Kim with pain management. Welcome back to Healing with Dr. Kim. As you saw in our first segment, we focused on pain management with a patient, Sharon, that Dr. Kim is working with. Now we're going to talk about another patient that he's working with. It's me. Dr. Kim, as you know, I came to you several months ago,
Yes.
back in the fall, with severe shoulder pain. We knew that I had rotator cuff problems, and we were trying to prevent surgery. What was your thought process on how to help me prevent surgery?
Yeah. So the basic thing is that, I'm an integrative medicine physician, and one of my specialties is in acupuncture. So and I have gone through back surgery myself, and it didn't help me. And I realized that there is a proper place for surgery, and many people may have been helped, but I have my personal experience. So, and the other part is that shoulder surgery is not always guaranteed results, and I think the hip and the knee surgeries are much more guaranteed results. So the way that I look at it is that I want to try techniques that are going to be less invasive first, and acupuncture being one of them. And so again, using neuroanatomical technique, we've asked to treat you in terms of your brain to recognize that area should be released or reset. We tried it, didn't work. We did direct treatment using electricity. It gave you some relief, but it did not.
But not long term.
Lasting relief. So I guess if I was one way to do this is that some people might just take advantage and say, let's treat it again and again until you give up. The way that I was trained, you treat it, and if it doesn't work, that means our assumptions are not correct. Our assumption that this can get better with acupuncture, it does not need surgery, may not be right. And at that point, what I did was to find the person that I think would help you the most, and find it. In this case, I thought it would be an orthopedic surgeon who does nothing but shoulder.
Exactly, which is what I did.
Yeah, and then that person can order an MRI. Once they see the MRI and they can know more, then it makes sense to both of us. Like, oh, no wonder acupuncture wouldn't work, because there were problems in multiple areas.
Yes.
And they were not just inflamed, they were torn. And as a result, then everyone, including the surgeon, you and me, can agree that surgery is the best course. It's not ideal course, but it's the best course for you.
So several weeks ago, I did have surgery, and there was a torn rotator cuff, a torn bicep, and bone spurs were removed, as well as scar tissue. And it was brutal. I will admit, it was brutal. And after the first couple of weeks, I came to you and you started doing acupuncture on me, and it helped tremendously. It's interesting, though, as you've done acupuncture on me for other things over the last couple of years as well, how when you put the needles in my ear, how it may sting a little, but then the pain diminishes in the area. What causes that? Does that go back to the nerves that we talked about in the first segment?
And absolutely. So the neuroanatomical acupuncture techniques were developed in France, China, and Germany, and in America as well. And all of them basically use different acupuncture points to interface with. It's a technique to communicate with you. So in a way, the way I look at it is that I'm using acupuncture to program your nervous system, and the ear is a wonderful place to do that. And basically, I am connecting with a center known as thalamus, which basically mediates or processes all pain in the brain. And obviously, I'm not acupuncturing your thalamus, but it's a point in the ear called thalamus that I'm acupuncturing, and you saw the effect of it. And this technique is very different because you get immediate results.
Oh, I did get immediate results, yes.
Gratification. And then it does wear off, but I think that still the effect is more profound than just taking a pill.
Yes, and it lasted several days. And I also will say that it also prevented me and helped me to get off of the narcotics, because with the opioid situation in the country now, it's very easy for people having surgery to get addicted to the narcotics because the pain is so great.
I agree. And I think that the acupuncture, or the neuroanatomical acupuncture especially, I think is a very good tool to consider using, especially for serious pain, like post-surgical pain or chronic pain that people turn themselves into narcotics. And instead of doing that, I think that communicating with the brain and doing the treatment to reset the conditions of the pain can be an important tool to try, rather than just use medication right away.
One of the things that I did right away, I started physical therapy, I did acupuncture, I did massage, I hit it from all angles, and then you and I talked, and we talked about cold laser. Let's talk about what cold laser therapy is and how it helped me, because it helped tremendously.
So the way that you went about treating, I think it really inspired me, because it's really truly integrative. And we were doing everything, but you couldn't drive. And I know that there was another healer that was offering to help you with a cold laser, but you couldn't just get to her.
Right.
And we had a unit that I wasn't using at the time. And the cold laser basically is what we call infrared laser, and it is best uses of cold laser appears to be for wound healing. And one of the things that is done differently in my clinic is that when I learn about a new technique, I do a lot of research. So that unit I've had for about 10 years, and the manufacturers have their own idea. But when you do the research, the literature kind of comes out and kind of backs you. And the best uses appear to be with wound healing. And since my practice for pain management is more chronic pain, nerve pain, wound healing actually is something that can grow, but not a lot this moment. So it gave me idea that it's like, and it's really funny because, you know, they use cold lasers for our animals.
Right.
When I take my dog for surgery, the vet asks me, you know, we can do cold laser for your dog. So
why not?
Yeah, why not on
use
us?
it on us?
You know,
right.
let's use it on pet owners too.
Right.
And
well, it helped tremendously,
yes.
And I know you have to be very cautious. You
Yes.
can't look at the laser.
That's correct.
But the system that you and I talked about me using was, you know, there's a cord with the laser component on the end, and I would take and segment my shoulder, and I would, you know, do a minute
Yes.
per,
Yes.
and do it 3 to 5 times a
Yes,
day,
yes.
and it helped tremendously.
Yes. And I think that's one of the tools that I consider that can increase patients' own self-efficacy or empower the patients. And I've done that with take-home ultrasound, take-home laser, sometimes take-home electronic machines. And I think that I'm wondering, in the future of medicine, maybe that's the future, is that when
Well,
you
it
have
sure was more convenient.
Correct. And maybe we'll have a drone that will
Right.
bring the thing to you and say, you know, here's your doctor's prescription.
That's a
and,
great idea.
You know, watch the YouTube video. This is
Right.
how you do it.
Well,
And-
I had done it before
Yes.
when I'd had a broken wrist, so
Yes.
I knew how to do it, and then you refresh my memory. I think one of the things that made me feel so good is that my physical therapist and my surgeon, when I
Yes.
went back for my follow-up, really were very pleased with how far along I was at 6 weeks compared to most patients. I think the reason for that is we together hit it at all angles,
Yeah.
based on what the surgeon recommended, and then my consultation with you and your staff. And I'm back at work, and granted, I'm not 100% with range of motion or strength, but I feel like I'm much farther along than I would have been had we not done those things.
Do you feel like the treatments that you have done has helped you to get off the pain medications?
I'm completely off of the pain meds, completely.
And that's, I think, the important tool that's currently being overlooked. And it's a bit sad because a lot of people in the U.S. are suffering because of the narcotic epidemic. And I think that it's a shame that the insurance companies won't pay for other modalities, but they will pay for people to get more narcotics. And I think that's really something that needs to change in the future.
I think so too. I want to commend you for allowing me to take the cold laser home, because that's what also made the difference. Because as you know, I couldn't drive for
That's
7
correct.
weeks.
That's correct.
And that's bad enough as
Yeah.
it is. But
Yeah.
then when you try it, you know, I had to go to physical therapy twice a week, and then massage
Yes.
once a week or maybe once every 2 weeks, and then here for acupuncture. And having the cold laser at home allowed me to manage that part of my healing. And it also kind of empowered me. I
Yes.
felt like I had more control of what I could do to help ease the pain.
And I think that is very important. I think that's why I think the pills become very easy, because people are empowered and they take it. Unfortunately, the more you take it, the more your body gets used to it.
Right.
You need the higher doses. In this case, you had no immediate effect, but when you use the laser as prescribed, what had happened is that you just had less pain.
Well, because it promotes healing in the tissue
Absolutely.
and in the bone, and I have 3 screws in.
Yes, yes.
So I also, was particular with where I did the cold laser more often.
Yes.
So the bone and the screws
Yes.
around that would heal.
Absolutely. And when you were here, I think that you would recall that we would also use infrared
We did.
light, and we would stimulate the entire area until you had an aching pain sensation, and then we switched to another modality. So I think that integrative medicine, as an integrative medicine practitioner, that pain management is one of the areas that I focus, and using all the tools I think is extremely important. And in this case, we were able to help people using natural modalities, natural ways, not involving pharmaceuticals, and get great results. And I think that that's kind of the reason that I went into integrative medicine in the first place.
Well, you have certainly made me feel better after having shoulder surgery, and you have helped so many patients. I want to personally thank you on behalf of myself and all your other patients that come to you. You do a tremendous job with all types of pain management and other types of chronic illnesses that patients come to you with. So I want to thank you for your time today to share what you do in your practice.
Well, thank you, Lana.
Thank you. Thank you for joining us with Healing with Dr. Kim.